Welcome to the module, A Guide to Understanding Vaccine Beliefs, Cultural Competency, Cultural Humility, and CLAS, a Frontline Forces training presented by Superior Health Quality Alliance. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of people. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients or residents, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about the role of culture in healthcare settings. What you know and how you use the information improves the quality and safety of the patients you care for. This learning module, A Guide to Understanding Vaccine Beliefs, a Cultural Competency, Humility, and CLAS, is part of a series of modules exploring cultures in different ethnic, racial populations and how they view vaccines. You are viewing the first module of the series, which provides a general overview about cultural competence, humility, and culturally and linguistically appropriate services, referred to as CLAS. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to describe cultural competency, cultural humility, and CLAS. Identify how to practice competence and humility. Explain benefits to providers and patients or residents. Discuss how CLAS can be effective in a healthcare setting. And describe why it is important to practice competence, humility, and CLAS. Before learning about how individual culture affects medical decision making, it is important to have a basic understanding of what it means to use cultural competency, humility, and CLAS when working with diverse groups of people. Most likely, if you work in healthcare, you've heard these terms before, but maybe you are not sure why they're so important to everyday interactions. Cultural competence refers to the ability to recognize your own cultural beliefs and values, allowing you to realize they may differ from other individual cultures. Having this awareness gives medical staff the ability to effectively interact, treat, and care for patients or residents with different cultural backgrounds. Cultural humility is a process of reflection and lifelong inquiry involving self-awareness of personal and cultural biases and awareness and sensitivity to significant cultural issues of others. Core to cultural humility is the deliberate reflection of values and biases. Cultural humility encourages developing an attitude of recognizing a patient or resident as their own best authority and learning from them. This is an ongoing, active process for healthcare providers. We as individuals may belong to the same cultural group, but we all have our own individual culture within the group. When you practice cultural humility, you possess an awareness and sensitivity of how a person's culture may influence and affect their healthcare behaviors, such as accepting certain medications or vaccines. With this knowledge, you can develop an effective treatment plans honoring the beliefs, customs, and values of your patient or resident. Cultural humility includes focusing on an intrapersonal and interpersonal approach to care. By involving a patient or resident in their care plan, you are developing a culture of patient-centered care, hereby gaining the trust of your patient and resident population. CLAS, an acronym for Culturally and Linguistically Appropriate Services, is a 15-step guide designed to advance health equity, quality, and eliminate health disparities. These services are respectful and sensitive to the individual culture of each patient or resident, including beliefs, language, health literacy, and communication needs. Medical providers have an ethical and legal obligation to improve patient, resident, and clients' quality of life. By providing CLAS in your healthcare facility, you are practicing cultural competency and humility for a safer, more effective, and equitable experience for your patient or resident population. Practicing cultural competence can be achieved by implementing a few strategies that will enhance the patient or resident provider experience. These strategies are part of a process which improve the scope of care medical staff can provide to work with and effectively communicate in cross-cultural situations. Strategies can include denouncing stereotypes and biases, checking implicit biases, and speaking out against stereotypes. Adapt services you provide to the needs of each patient or resident's unique culture. Anticipate barriers to obtaining assistance and map out a plan. Explore and immerse yourself in a new cultural experience. Consciously work to increase skills and practice communicating with diverse cultures. Caring for a person with cultural humility involves self-reflection and assessment of your personal values, beliefs, and implicit biases to ensure that biases stay out of the person's space. Develop approaches and skills to treating the patient or resident and their illness. Appreciate each person's expertise on their health and culture. Provide individualized care. Take care not to place patients or residents under a cultural label. Acknowledge what you do not know and be willing and open to learning. Embrace each person for their individuality and empathize with their life experiences. Recognize and manage power balances by identifying expectations different cultures have for physicians and how cultural differences may impact health outcomes. Continue learning and growing as a person to better care for your patient or resident population. Implementing these strategies into your healthcare facility will yield many positive results. You may see a reduction in racial and ethnic health disparities, increased medical trust, and patient and resident retention increases with higher rates of compliancy. With positive patient or resident changes, staff may find they work better together as a more inclusive, cohesive team. One of our goals as healthcare providers is to have happy patients or residents with positive health outcomes. By implementing cultural competency, humility, and CLAS into our daily interactions with each person, we can achieve this goal. Our patient or resident population will experience improved quality of care and communication, as well as a reduction of racial and ethnic health disparities. An active participation in healthcare decision-making will be highly encouraged. Each patient or resident will be offered resources, services, and treatment plans tailored to their own individual culture. CLAS allows providers to consider the cultural beliefs of each person, what language is preferred by an individual, the health literacy level of each individual patient or resident, and their communication needs. By considering each of these factors, providers are better equipped to demonstrate understanding and respect for individual culture, provide more effective and equitable care. Using CLAS techniques improves the quality of service by staff, cultural competency and humility displayed to individuals, the use of language services, and the ability to provide health literacy. If executed properly, the patient-client-resident experience will improve along with satisfaction and engagement, important for quality of life and improve health outcomes. Take a moment to reflect on your childhood and answer the questions below. When you were sick, did you go to the doctor? What type of food did you eat when you were sick? Did your family use alternative healing practices? Did you get childhood vaccinations? What type of celebrations were practiced in your home? And who lived in your house? Think about how your individual culture may differ from a friend, coworker, or partner. Below are tools for you to utilize. Follow the links to access resources, trainings, and standards. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Guide to Understanding Vaccine Beliefs, Cultural Competency, Humility, and CLAS quiz on the Frontline Forces webpage or in the YouTube description below.